Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students or nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that would really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody, and I hope you guys enjoyed your weekend wherever you are right now, whatever time zone you're watching me right now. I just wish you good morning, good afternoon, and good night just in case I don't get to see you. Yes, before anything else, I would just like to address the elephant in the room. Wow, diba? It's been a while since the last time I uploaded a video, and probably a month or two. Yung napanood yung video upload ko last week, yung actually ay bank ko pa yun na videos o yung mga videos na dapat ay ginawa ko nung last month, previous month, yung June. Kaso, I just need to take a day off, like a time off from YouTube. Not totally quitting YouTube, but because, alam niyo naman, kung hindi niyo pa alam, kung hindi ko pa nakwento sa inyo, I actually transferred from a new unit now. So, I am now a staff in ICU, medical surgical ICU. And I just had, a moment to adjust myself to the culture, to the new workload, to the environment, to the demands and all. But now I am back on track because, medyo nakahinga-hinga na ako. Medyo na-stress out lang ako nung mga nakaraang buwan kasi I had like I need to do some big of adjustments personally and professionally with my work. And I want to apologize from the bottom of my heart kung na-feel nyo na iniwan ko kayo, pero hindi po. Nandito pa rin po ako, opo, para sa inyo po. Nagpapasalamat ako because you guys didn't actually gave up on me. You keep on sending me love, showing your appreciation, sending me your messages, emails, mga nagko-comment dyan. Hindi ko man kayo ma-replyan lahat, but I truly, truly read all of your comments and I try to interact with you guys as much as I can. But yeah, that's the reason why I haven't been uploading lately. And also I took rest from doing contents. I just took my time and ngayon balik na ulit tayo. May panibago na tayo ulit na motivation. I kind of like forgot what is the reason, what's the intention why I created this video, this channel on YouTube, and that is to help the nursing students and nursing professionals to refresh their knowledge when it comes to nursing. Kind of like forgot that the main intention of this goal is this YouTube channel is to help you guys, and I can see that you guys are supporting me because we are now moving towards 20,000 subscribers. You guys, you have no idea how much it makes me happy. As the bigger the channel grows, the bigger the contents, the better the contents, and I hope you guys we can reach 100,000 subscribers by the end of this year. And I'm just really gonna put it out there. Help me out. Okay? So yes, tama na tayo sa mga kadramahan natin sa life. Mag-proceed na tayo sa ating first ever lecture for this week. Like you see on the title and like you see on your screen, this is all about nursing pharma, nursing drug study ng yung Vancomycin. Sa mga hindi pa nakakahawak ng Vancomycin, at sa mga luma pero hindi naman na luma talaga. Charing. Ito po ang iyong thorough drug study, your ultimate guide and studying your Vancomycin, which is your glycopeptide antibiotics. Antibiotics meaning may bacterial infection, hindi viral infection tayo ha. Gila sa inyo. Eto na tayo. By the way, kung hindi mo pa napapanood yung other nursing pharmacology contents, nursing drug study I created on my channel, I'll be putting the playlist link on the description box. Click the one out, or whenever the icon button pops out, click that one out because I'll be putting it there together with the other playlist I have on my channel. Use it, guys, because that's all for you for free. Okay? Now, let me share to you the objectives for today's lecture. All right. On this lecture, we are going to discuss this points about your Vancomycin. We're going to have classification, generic and brand name, route and dose of administration. We're going to study the mechanism of action, the indications, contraindications, adverse effects, and of course, this will not be your nursing drug study if we're not going to talk about your nursing responsibilities. So before tayo mag-proceed sa una nating slides, okay, sa formal discussion, I'm going to give you time to subscribe now. Go. Alright, welcome back. Ang bilis lang, diba? Hindi mo pinag-isipan yun. Huwag kang para kang ano ka dyan. Eto na tayo sa iyong classification, generic and brand name, and route and dose of administration. Alright, this is pretty straightforward, you guys. I'm gonna give you a table. Alright, so classification, glycopeptide antibiotics. Generic and brand name, vancomycin and vancomycin, respectively. Diba? Very straightforward. Now, in terms of route and dose of administration, I kind of like give you the IV route and dose. Okay, intravenous injection. Now, in adult, give by intermittent IV infusion over at least 60 minutes or at rate of 10 milligrams per minute or less, whichever is longer. 2 grams per day is divided doses, 500 milligram every 6 hours or 1 gram every 12 hours. Renal impairment, watch out for this, adjust or reduce dose. Obesity, you see the full labeling on the medication. Now, one key term, kailangan mo talagang i-infuse ang iyong vancomycin. Hindi siya binibigyan na bolus. Huwag kang para kang dinagrade 2. Kung mayroon kayong infusion pump sa hospital nyo, normally niraran namin to ng 1 hour. Yes, 1 hour po. Para maiwasan yung adverse effect, which is we're going to discuss about that later on this lecture. Now, sa children naman, give by intermittent IV infusion over at least 60 minutes. 1 hour ha. Neonates less than 1 month, initially 15 milligrams per kilograms, then 10 milligrams per kg for kilograms every 12 hours for neonates in the first week of life and every 8 hours thereafter up to 1 month of age. Greater than 1 month, 10 milligrams per kilograms per dose every 6 hours. Renal impairment, adjust or reduce dose. Obesity, see full labeling of your medication. All right? So once again, this is your classification, generic and brand name, route, and dose of administration. Take a screenshot, use it as a guide. Don't worry, because as we go on in the this discussion, I'll make sure that we're gonna touch down the key important aspects of administering vancomycin. Now, mechanism of action. How does this medication work? Eto na tayo ha, makinig ng mabuti. The bacterial action of vancomycin results primarily from inhibition of cell wall biosynthesis. Specifically, vancomycin prevents incorporation of lysine and acetylmuramic acid o yung tinatawag nating NAM, NAM, and N-acetylglucosamide o yung tinatawag naman nating NAG peptide. Subunits from being incorporated into the peptidoglycan. Let me say that one more time. Peptidoglycan matrix, which forms the major structural component of gram-positive cell walls. What's the key point? Vancomycin is used for gram-positive bacteria. Para kang bobo ka dyan, okay? Vancomycin forms hydrogen bonds with the terminal D-alanine myotisis of the NAM or NAG peptides, preventing the incorporation of the NAM and NAG peptide subunits into peptidoglycan matrix. In addition, vancomycin alters bacterial cell membrane permeability and RNA synthesis. There is no cross-resistance between vancomycin and other antibiotics. Vancomycin is not active in vitro against gram-negative bacilli, mycobacteria, or fungi. Once again, that is your mechanism of action. Malinaw ba yun? Of course, as clear as the sun. Kaya very important, guys, na bago ka magsa-start ng antibiotic therapy, kahit na anong klaseng antibiotic therapy, importante ang iyong septic screening para malaman mo ano ba yung nilalabanan mong klaseng microorganism. Okay? Because that will depend kung paano yung approach mo. It's either gram-positive or gram-negative sila. Okay? Eto na tayo sa iyong indications. Kanino mo nga ba ibibigay ang vancomycin? Ano-ano yung mga indications niya? Okay. Eto na tayo, guys. Listen up. Very straightforward. Administered intravenously, vancomycin is indicated in adult and pediatric patients for the treatment of septicemia, severe infection in blood. Ineffective endocarditis, skin and skin structure infections, bone infections. Sa mga ortho cases, binibigay din to. Sa may mga amputation, ito rin siya. And lower respiratory tract infections. Administered orally, vancomycin is indicated in adult and pediatric patients for the treatment of Clostridium difficile-associated diarrhea and for enterocolitis caused by Staphylococcus aureus including methicillin-resistant strain. Kaya mapapansin mo, mag-order yung doktor ng C. diff stool bago magbigay ng vancomycin. Kasi para ma-confirm kung merong ang Clostridium difficile. Merong presence ng microorganism. Okay? Sa stool na Clostridium. So, dapat i-run mo na ang test bago tayo magsimula na antibiotic therapy. Okay ba yon? Okay. Now, let's proceed. Contraindications. Kung kanina tinalakay natin, kung kanino mga pasyente mo siya ibibigay, kanino mo naman siya hindi ibibigay this time. Alright? So, hindi mo siya ibibigay. You're not gonna give this medication to... Vancomycin is contraindicated in patients who have had an allergic reaction to it, meaning allergic reaction sa vancomycin and any vancomycin derivatives. Period. Malinaw yon? Malinaw. Ngayon, bago tayo mag-proceed sa adverse effects, baka naman mag-subscribe ka naman dyan. At i-share mo to. Charing. Mag-give you time. Go. Very good. Thank you so much for doing that. Mag-proceed na tayo sa iyong adverse effects. Alright, what are the adverse effects of your vancomycin? Now, this is pretty crucial, you guys, okay? So I want you to open your ears, grab your pen and paper, and take down notes. Now, as with any medication, vancomycin has side effects that require consideration of the risks and benefits of using the drug. Some of these side effects include the following, or adverse effect includes the following, which we're going to have on this slide. First one, kidney damage, which requires very close monitoring of drug levels and changes in risk based on the patient's characteristics, disease states, and other medication. Meaning, ang vancomycin ay nephrotoxic, because this is going to be metabolized in your kidney. So, watch out for normally magpaparan ng doktor ng kidney markers. Mga yan, ano ba yung mga pinirahan sa kidney markers? Ano ba yung nirahan sa kidney markers? Nakalimutan ko na. Bio and Crea. Bio and Crea. Creatinine level. Pwede ring mga serum, electrolytes, something like that. Okay? So, nephrotoxic po ang iyong vancomycin. Next, hearing loss. Meaning, ang pasyente ay pwede mag-develop ng hearing loss kasi ang vancomycin ay ototoxicity. Okay? Which is very rare with today's version of the drug but may still be possible when combined with other medications that can cause hearing damage. Watch out for hearing loss. Last one is red man or red person syndrome. Narinig nyo na ba to? Sige, papakilala ko siya sa inyo. This is related to the rate of infusion of the drug and is easily reversible by decreasing the rate and pre-treatment with antihistamine. In practice, close monitoring of vancomycin can prevent or decrease the severity of this side effect. Meaning, kapag binolos ng nurse, tatamad-tamad, free flow lang yung iyong vancomycin, hindi binantayan yung swero. So, ang bilis. Natapos agad ng 10 minutes. Tapos ang vancomycin. Normally, dinidilute to ng 500 or 250. So, kailangan mo siyang i-run ng ilang oras again? 60 minutes, 1 hour. Para maiwasan mo ang iyong red man syndrome or red person syndrome. Once again, you guys, these are the adverse effect of your vancomycin. Now, ito na tayo sa iyong nursing responsibilities as a nurse. As a matalinong nurse, what is your responsibility? Eto siya, tatalakayin natin sila isa-isa. First one, can cause ototoxicity. Diba? Diniscuss natin yung sa adverse reaction. ototoxicity, nausea and vomiting, nephrotoxicity, anaphylaxis, Redman syndrome, assess for infection. Assessment is the key to success. Obtain culture prior to initiating therapy. What did I tell you? Do your septic screening first before you do any, not just for vancomycin, but any what? Any antibiotic therapy. Ano-ano ba yung mga sinasabi kong septic markers? Septic markers, that includes, what's this? Your blood cultures, urine cultures, wound cultures, pwede rin magkaroon ng swab, nasal swab, MRI swabbing, what's this, corona swabbing, ano pa, sputum culture, lahat na may klaseng culture. 'Di ba? Meron tayong aerobic sa blood culture, aerobic and anaerobic. Meron akong discussion na ginawa ko sa how to properly take yung nursing procedure and skills. Lecture about sa blood culture taking. So, sa peripheral or central line. So, panoorin mo yung kasi makakatulong yun sa'yo. In a way, that discussion is related to this. Okay? So, obtain blood culture prior to initiating therapy because you want to establish what type of organism you are fighting with. Okay? Parang bulag ka dyan. Bigay lang ng bigay ng gamot, hindi naman nagtatanong ng na-establish ko anong microorganism yan. Next, monitor blood pressure for this can cause any hypotension to your patient. Okay. Next, dose dependent droserum trough levels frequently. Nakarinig na ba kayo ng laboratory order ng doktor niyo na banco trough level? Normally, binibigay yon sa facility namin bago ang 4th dose ng vancomycin. Meaning, example, 500 mg of vancomycin BID. Starting ka. Magka-count ka ng 3 doses. So, kinabukasan, kasi morning shift ka, magsa-start ka ng 1st dose. Yung night shift, endorse mo 2nd dose. Yung morning shift kinabukasan, the next day, that's the 3rd dose. Yung night shift, bago yung ika-4 na dose, kailangan mag-run sila ng banco trough. At ang kung dose nyo, at ang timing nyo sa hospital is, ang BID nyo is 9 p.m., 9 a.m., 9 p.m., 9 a.m. Bago mag 9 p.m. ng gabing yon, kailangan may trough level ka na. Because you don't wanna delay the dose of vancomycin. It will affect its potency. Para maiwasan mo yung resistance, magkakaroon ng microorganism resistance to antibiotic resistance. Okay, so trough level. And then, i-relay mo sa doktor mo yon. Doc, ito na yung trough level mo. Bigay tayo, same dose. Mag-a-adjust tayo ng dose, mas mababa or mas mataas, or i-discontinue na natin. That's how are you gonna deal with trough level. Okay? Okay. Next. Administer over at least 60 minutes to avoid skin irritation. Use infusion pump. Run it for 60 minutes. Kung hindi ka familiar sa IV infusion pump nyo, magtanong ka. Huwag kang para kang dyan. Okay? So once again, these are your nursing considerations when you are administering vancomycin. Thank you so much, you guys, for watching. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan mo nga yung upload natin this Wednesday because that's going to be your favorite topic on this show. On this channel, which is your nursing test banking. Ang saya, hindi ba? Tulungan mo na nga ako, ipamalita mo na sa Radyong Sira. Pinakabago, ang pinaka-fresh at pinaka-libreng nursing review center sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I have a podcast channel. It's 3 a.m. Conversation with Neil Galve. It's been a while since I uploaded there, but watch out for the newest episode of that podcast. I'm so excited to go back. You guys have a good one.